Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. In recent years, studies have shown that omega-3 fats play an important role in the prevention and complementary management of depression, post-traumatic stress disorder, and other mental health problems such as anxiety and even psychosis to some degree. Now, in this update, I want to share with you several eye-opening studies highlighting the impact of omega-3 fats on depression and post-traumatic stress disorder, which we often just call PTSD. So the first study involved a publication in the American Journal of Clinical Nutrition back in 2008, where researchers evaluated almost 1,400 older subjects. Their average age was about 75 years old, using a standard depression index. Now, it's known that depression affects about 8 to 16% of older adults, although later life depression we think is underdiagnosed and undertreated. There's probably a higher percentage of older and elderly people that have depression where it's not even diagnosed. The study revealed that those with lower blood levels of the omega-3 fat called EPA, which is eicosapentaenoic acid, EPA, which you get from fish and fish oil, that individuals with lower blood levels of that omega-3 fat EPA had higher rates of depression than those with higher EPA blood levels. So in the brain, EPA is known to decrease brain inflammation. It improves the brain cell receptor function and signaling mechanisms so that the brain cells function more optimally. Now, as we age, the brain's ability to synthesize its own EPA, omega-3 fat, from other omega-3 fats becomes compromised due to more sluggish enzyme action. So this results in lower blood and brain levels of EPA and possibly higher risk of depression, according to the studies that we have. Hence, fish oil supplementation is thought to preserve more optimal brain levels of omega-3 fats as we age and may also help to prevent depression. So the next study really drives this point home. So the next study of importance was published around 2007 in the Australian and New Zealand Journal of Psychiatry. So in this study, researchers treated 60 patients who had major depression using either EPA, so this omega-3 fat fish oil that's rich in EPA, 1,000 milligrams of EPA, or the drug Prozac, fluoxetine, at 20 milligrams a day. So Prozac's a standard antidepressant drug. And they gave some of the patients the combination of the EPA fish oil and the Prozac. So here's what the results showed this, that the patients ingesting the omega-3 fat supplement, 1,000 milligrams of EPA, had the same treatment benefit as those taking the fluoxetine or the Prozac medication. But the best results occurred in patients taking the combination of EPA and Prozac. This group showed an 81% response rate, compared to just over a 50% response rate in the groups administered either the EPA or the Prozac as single therapies. Now, in 2016, an important study also showed that providing PTSD patients with an omega-3 fat supplement containing both EPA and the other type of fish oil fatty acid known as DHA, which is docosahexaenoic acid. They gave them both EPA and DHA. And that supplement resulted in decreased severity of PTSD symptoms. So this study involved 110 PTSD patients who had sustained severe physical injury and were left with PTSD symptoms after conventional treatment. They saw a benefit. Then in 2017, another study involving 83 PTSD patients showed that the administration of omega-3 fats, again, EPA and DHA at sort of different doses for 12 weeks, decreased a key physiological PTSD symptom, which entailed lowering their resting heart rate. So a major physiological symptom in many cases of PTSD is a pounding heart rate that's elevated, an elevated pounding heart rate. In this study, elevated red blood cell levels of EPA were strongly associated with reducing the elevated heart rate in these patients after the omega-3 fat supplementation was initiated. So in conclusion, evidence continues to show that incorporating omega-3 fat supplementation, especially the use of EPA, eicosapentaenoic acid from fish oil, into the complementary management of patients with depression and PTSD is likely to help improve outcomes for these patients. Supplementing with omega-3 fats as we age may also help to reduce the incidence of depression in older subjects who are highly prone to this mental health disorder. So as we get older, there's a greater risk of depression. So there's also very little risk in taking an omega-3 fat supplement like this other than its potential anti-clotting effect, which may amplify to some degree other anti-clotting medication drugs. As such, anyone taking an anticoagulant drug should speak to their doctor first before starting an omega-3 fat supplementation routine. Now, I've included the study references in the text below, so thanks for watching, and I'll see you next time.